Hello, everyone. Welcome back to the Dating After Divorce podcast. I am so excited to introduce today's guest to you. Dr. Krystal Sodaitis is here with me on Zoom. She is a board-certified pediatrician, transitioned from academic medicine to health plan leadership in 2013. She is currently the Associate Chief Medical Officer for a health plan based out of her home state of Illinois. Dr. Sodaitis has advanced certifications in physician coaching, leadership coaching, and deep dive coaching. Welcome to the podcast. Please tell the audience about yourself. Tell us who you are, something fun about you.
Yeah, so thank you so much for the intro. So I am a pediatrician by training, and something fun about me. So the reason I got certified as a life coach was not because I wanted to coach, but because I saw it as a really great tool in my leadership strategy. And along the way, and I really wanted to get promoted. And so along the way, I fell in love with one-on-one coaching. And I started coaching. I saw that in the gifted communities, people who are cognitively gifted, IQs over 130, there was a fall off of support. You can pretty much, if you Google like how to support my gifted child, there's probably 1,000 hits. But once people get into adolescence and young adulthood, there isn't that same kind of support. And people start self-medicating, drugs, alcohol, they fail. There's a lot of, there are a lot of issues in that group of people. And I kind of made my way, since I'm a physician, made my way towards more and more attracting physicians, and specifically physicians with neurodiversity, because that puts them at a little bit higher risk of having, at-risk behaviors. So, and I just fell in love with the population. I am neurodiverse myself as a physician. I think most high-achieving people probably are, just by virtue of the IQ that's required to get to that level of education. And then when you put on top of that an area, there's a very definable area of your brain that doesn't work, it really does create a lot of problems for people. And so I really just love to show people how their neurodiversity, this difference in their brain, is actually a gift, and they can use the parts of their brain. Our brains were not designed to be all good at one thing, or all good or all bad. We all have areas that we have strengths, and we all have areas where we struggle. It's just that when you have a strength that's like super high, those struggles, you really feel the difference. And so I love helping people see like these areas that are super high, you can use it to really help those areas where you struggle.
Yeah, I love that. And, the first question we were going to talk about was, what is neurodiversity? Because when you explain it that way, like I think sometimes when we hear it, it's like, oh, this person is different. Right. But it almost sounds, the way you explained it, it almost sounds like, oh yeah, no, we're all different.
We are. And there are inherent issues with the term neurodiversity, because it does imply otherness, right? Like neurotypical, most people are neurotypical, at least those people that sit in the middle of the bell curve. And then the people outside the bell curve are neurodiverse. But really, we're all neurodiverse. Like it's a phrase that was intended to mean that all differences in the brain are on the spectrum of normal.
I love that. Every brain is normal.
Every brain is normal. Right.
That's so good. And I like that, because I remember, and this is way before I, came into the work, and just my own story, stuff that happened in my childhood. I was actually a gifted child. I went to
You're still a gifted adult.
I'm still a gifted adult. I don't know. my peers and I joke about what does that really mean right now? I went to the first school for the gifted in Nigeria back in the, oh my God, early 90s. Such a long time ago. I don't think about this stuff anymore. And the expectations on being labeled gifted then created this thought and pattern of thinking that really went on, you could say, for several decades, where whenever something went wrong in my life, then I would think, well, what's wrong with me? what's wrong with me? Because I was different, so to speak, but then there was always a gap between what I was supposed to be doing and what I was achieving and all of that.
Right.
So when you say all brains are neurodiverse, everyone is normal, that really brings a lot of like relief to someone who has that thinking pattern.
Yeah. Because it's like, gifted doesn't mean that you are good at everything.
Yeah. Oh yeah.
Yeah. In fact, there are a lot of things that probably not very good at all, but a lot of people, especially if you're, put in a situation like this, well-intentioned, right? Putting you in a school specifically for gifted children, on some level, it was beneficial for you, right? Because you were able to be educated at that level. But for many people, anywhere they struggle, anything that might challenge that identity means, oh, I must not, like that was a mistake. I'm not really that smart.
Yeah. No, 100%.
Don't let anybody know. Right?
Yeah. And that difference, and I think this really applies to all areas of differences, divorced women experience this. So once you have the label divorced, opens up a similar pattern of thinking, oh, yep, I failed. Anything that doesn't go with being married now or being partnered is now a problem. So I wanted to ask about just shifting into relationships. There is a subsection of the population that I work with who are highly intelligent, like you said, like the population that you work with, gifted women. And there are those who, have labels, who have diagnoses, whether, like you said, some diagnose themselves or have ADHD. I've heard some women that I work with refer to them as socially anxious. Divorce does create a lot of anxiety. Many of my listeners struggle with anxiety for a very long time during and after the divorce. How can someone really look at these differences? Because sometimes they pile on. How can we start looking at these with sort of self-compassion in how we are in our internal dialogue?
Yeah, so that's such a good question. And, something that that I learned from, one of my coaches, and that is, we never make ourselves wrong for being who we are. So, for example, let's say that you struggle a little bit with executive functioning, and it's hard to get out the door in time. So you never make yourself wrong, and maybe you strategize, and when I work with people, we come up with strategies to help them get out the door and to wherever they need to go on time. But if you don't get there on time, you don't make yourself wrong for that. You understand, okay, here's where I struggled. I'm 15 minutes late. Do whatever, needs to be done. Sometimes it doesn't make any difference if you're 15 minutes late. Sometimes there's some people that you need to, either apologize for or take ownership of the fact that you are late, but you don't make yourself wrong. Like, I'm a late person. I have a problem. I can't do this. That's the first part of, and I think the key really to creating self-compassion for yourself.
Yeah, I love that. I've coached women who have talked about, well, I don't know if I can start dating because my house is so messy. Like, I can't bring someone to my house because it's not spotless. It doesn't look Instagram worthy. I need to fix this before I will be worthy of a relationship.
Right, exactly. And sometimes there's nothing to fix. And the other part too is, when you start in on a relationship, you need to be genuinely who you are. I'm sure you talk about that all the time, right? Is that if you go in and let's say you have somebody come into your house, right? You have an organizer come into your house and they organize everything and it's absolutely spotless, and you portray yourself as this person who gets everything, all the papers are filed in the right way all the time, that your partner is falling in love with someone who you're not.
100%.
Embracing who you are is like, you know what? I live with piles of paper on my desk. Like, that's who I am.
Yeah. My husband and I, we have matching piles of papers in our offices.
Yeah.
And I think it was one of the first things we talked about. Like, we both are very clean people. So he's clean in terms of like, things are washed, things are clean. But we both have like our offices.
Yeah.
We'll have like, okay, our mail is over here. And I like, if you go into my office or his office, we just have, there's a certain, and I think I knew that about myself. Ideas, I'm always, always with the ideas. So there's always a stack of books. There's always a stack of papers. There's always notes and scribbles. And one of the things I loved about him is like, we matched. I felt like, okay, we're in the same place here. Like our home will be clean. And our matching sets of paper. And I think that brings me to like, really, there is someone out there who matches who you are.
And the beautiful part about that is exactly, you don't make yourself wrong for having the piles.
Yeah.
This is how I organize my desk, because I bet if I asked you, hey, can you go grab that, or if he asked you, like, can you go grab that piece of paper, you would know exactly where it is.
Oh yeah, 100%. 100%. Yeah. Yeah.
So if you tried to file it away somewhere, by the time anybody asked you where it is, you couldn't remember what the filing system is. Like, I don't remember how I decided to organize them.
Yeah. There was this one time I took a phone away from one of my teenagers, and I was like, I'm going to hide this really well. And we couldn't, when it was time I couldn't find it for months. I was like, sorry, dude. You shouldn't have, you shouldn't have gotten your phone taken away, because now I have no idea where I put it.
Yeah.
That was kind of fun. So let's talk about, those who do have an actual diagnosis. So ADHD, autism spectrum disorder, any other disability where it's like, okay, this is official. I'm dating. This is something that when I do like someone, I will want to reveal this to my partner, or it's fair, it's right for me to reveal it. This causes some of my clients a lot of anxiety.
Yeah. One,
the brain goes into this indecision. Well, I want to reveal it up front. I don't want to invest in this relationship if they have a problem with it. So I want to reveal it too early. And so sometimes they consider revealing it at a time where the person doesn't really have enough information to consider it. Or they go way in too late. And now it's like, I can't, it's too late. He's going to think I was lying to him. What are your thoughts around that?
There's no perfect time, right? It's really individual. There are people who will, if they're using an app, they will put it on their app, right? Autism, dyslexia, it's just a fact, right? Right. When we talk about it from a coaching perspective, if you have a diagnosis, that just goes in the C line. That's just a circumstance.
Yes.
What anyone else thinks about it is on them. Now, that takes a certain amount, that takes a person who, is willing to just put it out there for people to know. And there's no judgment whether that's right or wrong. It's a personal preference, right? It's an initial, sort of like cut. It's like someone's either going to be comfortable with the fact that I have OCD or they're not. And if I want to know, this is, talking from the client's perspective, I want to know up front if they have a problem with OCD, they don't even have to don't even click on my profile.
Yeah.
But many people are not that open about their diagnosis. And I would say I would approach it at the same time you would approach any other sort of significant event in your, in your life. For example, if you, someone is going to make a decision to start talking about, if the divorce they went through was particularly traumatic, right? What's your level of trust to your partner to start talking about that? Or maybe they have a child that has a diagnosis. Maybe their child also has ADHD and autism. It's that safety. When you're starting to feel that safety, that trust, that's usually the time when you're starting to have those more difficult conversations. And I would put, a neurodiversity diagnosis into that bucket, into that same time frame.
Oh, 100%. Yeah, that's amazing. Because sometimes the person wants to lead with it because they're afraid of the difficult conversation that's coming. It's like the ladies who will swipe left on everyone, which is swiping left is no.
Yeah.
Not because there weren't some possibilities in there, but because they're afraid of rejection.
Yeah.
And so it's like, well, unless I'm 100% sure, or I think I'm 100% sure this person is going to like me or love me, I'm just going to swipe left because I don't want to experience that rejection.
Right.
And so it sounds like it's a similar principle, which is, hey, it's going to be uncomfortable no matter what.
Absolutely. Absolutely. And so,
Yeah.
and it's really a personal preference, individuals, whether or not you want to lead with that, just let people know. And I think it takes a certain amount. I think that generally takes some time, right? Many of the women I work with, and just to throw out, a little bit of data is that, women, adult women, is the fastest growing segment of the population with a new diagnosis of autism. And many women, especially high achieving, cognitively very intelligent women, are diagnosed. When I say later, I mean outside of childhood. And there are a lot of reasons for that. But it would not be uncommon for someone to be in the same situation where they are newly dating after divorce and they are discovering that they have one of these diagnoses. So when you are not so sure where you land in that, that's not the time to put it on your profile. You want to make sure that you know how it fits into your sense of self before you start putting it on your profile. Once you're solid, it's like, this is who I am. Like, I wouldn't, as a physician, I wouldn't judge anybody who had, diabetes, who had thyroid disease, who had any other disease, right? Hopefully our patients, we teach our patients not to judge themselves. This is the same thing. Don't judge yourself. It's just the way your brain works.
It's just a thing. Yeah. And there's also this frame of reference challenge that can come in. So, and this is one of the things that I work with my clients on really well in their profile. I was like, I'm always saying, because in relationships, it's huge, because when you have a word, especially when we just have a word that's supposed to encapsulate this entire experience, right? So now you have one word, and there can be a difference between what that word means to me, and what that word means to you.
Absolutely. And how it manifests itself.
Yes. Yeah.
Right? That's why all of these things, that's why autism is considered a spectrum, right? I would say all of them are. ADHD, dyslexia, the way it manifests and presents in one person is just that one person.
Yeah.
Right?
Yeah. And so like when you put it out there, I think these are some of my thoughts agreeing with what you said about, you could put it on your profile, or you could consider giving the opportunity to actually express to the person what this looks like. Because if you just put the word OCD, or you put the word ADHD or gifted on your profile, you have, 100, 200 people looking at it and having their own interpretations.
Yes.
Of what that means based on their own experiences, what they've read, what they haven't read, what they've seen on TV.
Right. Yeah.
Be completely the opposite of what you look like as an individual.
Yeah, absolutely. I couldn't agree with more. Yeah, that's a very good point.
Yeah. So what are some of the gifts of neurodiversity? Like how can we look at, oh, this is who I am. These are my characteristics. And then instead of just seeing it as a problem, which is sort of like our social conditioning, that's sort of the narrative, is that all of these things are a problem. How can we change the language to see them as gifts and walk with them in our lives?
Yeah. And each one is going to be a little bit different. There are some, and again, there are no hard and fast rules, but in general, there is something about a brain that has ADHD or dyslexia that makes that person can be more creative, more entrepreneurial. There was a survey done that showed that 35% of US entrepreneurs have dyslexia. It is the most common, neurodiversity diagnosed, but yet it seems like there is something about the way the brain functions that has dyslexia that also promotes this entrepreneurial mindset. Some people think it's, the ability to overcome, to, problem solve, right? People with dyslexia tend to have very good memories because they don't rely on their sight and their reading in order to learn something. They have to read something once, they read through it slowly, and then it's hard coded. People with ADHD many people have something called hyperfocus, right? We think of ADHD as being sort of like your mind is all over the place. I heard it once described as a pinball machine, right? Where the thoughts are just going everywhere. But most people with ADHD that I know and that I coach, when there is something that they need to do, they can focus on that for hours. There's no disruption. Time basically stops and they get it done. And it goes from there. Autism, we know that people with autism are very systems based. So if you have the type of job where it tends to be very repetitive, that's perfect for somebody with autism. If you have a child who needs a lot of structure, because that is so inherent to many people with autism, an autistic parent can follow that structure to the T. So there are, I could go on about, different neurodiversities and the different ways that the different gifts that they have, and the different, real tools and applicable tools that the tools and how they apply to sort of like real life.
Yeah. And I love those gifts. It's almost like when you list the gifts, I can imagine, several people listening to this would be like, that's interesting. I have all of these gifts. I wonder if I'm also, if I also have, quote unquote, the flip side of this. Like you said, a lot of women are later in life saying, hey, this experience that I've been having may fall under this diagnosis or this area. If a person is listening and is like, I wonder what would you recommend other steps? Or, hey, I've been in relationships and I've experienced, someone saying, hey, but you're so OCD or you're doing this, and they want to get diagnosed or they're considering this. What are your suggestions? What do you think a person should start with?
The first place is always your physician. Right. And more physicians are getting more comfortable diagnosing in adulthood. If you're in the US, it's generally, I wouldn't say easy, but it's easier to get access to someone who has experience diagnosing these neurodiversities in adults. Overseas, I know in the UK, it's extremely difficult. It's extremely difficult to get a diagnosis for a child, let alone an adult. And then I don't know in the other parts of the world where you have people, listening, how, easy or hard the access is. Anytime you have means, anytime you have money, things are easier. Many things are paid out of pocket, especially in the US, and I'm sure also in other parts of the world. You want to get someone who has, if your physician is not comfortable, you want to look for somebody who has experience in the diagnosis in adults, and for the women in female adults, because and I heard one podcast where a woman was basically talking about her journey through, diagnosis and discovery. She went online and she accessed someone that did it all. Many of these diagnoses come through, questionnaires, filling out just hundreds and hundreds of questions. And that can be done. That can be done online. So if someone finds, you always want to make sure that they're reputable, and a reputable source to take the diagnosis. Another good resource is whatever your National Association for Gifted is. In the US, it's NAGC, which is the National Association of Gifted Children, which it just has other resources available for adults. So in other countries, they probably do have some sort of body that oversees giftedness and gifted education. That would be the first place. The second place I would go after your physician.
Physician, yeah. And then what are your thoughts around people who are like, well, I have all of these traits. I think I have ADHD. I don't want to go the route of diagnosis. I want to sort of figure it out.
Yeah. I tell my clients there's only two reasons to get a diagnosis. Two big reasons. I mean, there's probably everyone has their hundreds, but for me, there's two big reasons. The first is, there's medication. For ADHD, you can get medication, and no one's going to prescribe you, these very regulated medications without a diagnosis. And the second is if you need accommodations. Some people truly need workplace accommodations, and the neurodiversities are, ADA, they fall under the American for Disabilities Act in the US. And so if you have a diagnosis, you are eligible for, workplace accommodations. Yeah. Other than that, you don't. If you find that, maybe you have ADHD and your brain is always going, it's hard for your brain to slow down, right? That it's just a constant stream of thoughts. Mm-hmm. Coming up with some ways to either slow those thoughts down, right? Not judge yourself for having those thoughts, or realize like, okay, what are the thoughts I really need to like hold on to? This one is just an airplane flying by. I don't even pay attention to it. But this is one I really need to pay attention to, right?
Yeah. Yeah. 100%. Yeah. No, that's amazing. Because I think there's a place where I've talked to some people who are like, I know I have this, right? I had a client who said, hey, I have dyslexia. And, she had that diagnosis. And there were other things that showed up, but she was just like, you know what? I'm just good. I'm just good with all of this. Yeah. Now bringing it back, go ahead.
And on some level, it doesn't matter, right? Like if you, like I have a client who has autism, and she takes the subway to work. It's extraordinarily difficult for her to take the subway. But yet she says, I'm just going to wear my headphones. It's New York. People are wearing their headphones all the time. They don't know I'm wearing my headphones because I can't stand the stimulus. So for another person, like maybe they don't have a diagnosis of autism, but they know that a particular thing, like let's say the subway, small enclosed places, loud noises, just come up with strategies to, either accommodate for it, like a headphones, or avoid it, right? Yeah. Some days she just walks, it's like 50 blocks to work, and she's like, I just can't do it. I'm walking to work today.
Yeah. Okay. Yeah. It's the 50-50 of life.
Yeah.
I was reading when I started, I need to finish the book. I love it. It's by Albert Ellis. It's an older book on rational, emotional, like the precursor to DBT. I forget what it's called. And he talked about how one of the thoughts that causes suffering is that everything I experience in life should be comfortable. I should always have what I want, when I want it, how I want it, 100% of the time. And I was like, oh my gosh, that's how I've been living my life. Like, I'm trying to work to make sure everything in my life is exactly as I want it. Mm-hmm. And he said that will just cause so much suffering along the way. And as you talked about your client, I was like, well, this is someone who has accepted that life doesn't always have to feel 100% comfortable.
Yeah.
That sometimes my brain will be doing one thing that the world is not accommodating in that moment. Like,
right.
I want to ride the subway and get to work at this time. However, my brain is like, no, we're just not going to do that today.
Right. Exactly. And it doesn't matter why. It's like,
yes. Yeah.
No, I'm
have you observed how neurodiversity impacts intimate relationships? Have you had any of your clients sort of bring things to you that are like, okay, I'm married, or I am partnered, or I have these friendships, and this is how this is playing out?
Yeah. A lot of it is when the diagnosis comes up only afterwards. And often it's an aha moment, like, oh, okay, now I understand, right? It's like, often we think, and we communicate this to our partners, like, I should be able to do this. I should be able to, handle it when my kid, throws up or whatever, and it shouldn't I shouldn't have a complete meltdown. But suddenly it's like, no, you know what? That's part of my autism. Like people randomly throwing up, like that puts me into a tailspin. So that's what it's a problem, right?
Yeah. Yeah.
Helping your partner understand, like, oh, I have a lot of trouble with whatever it is, organizing my intrusive thoughts. If it's OCD, right? Like I'm having these intrusive thoughts. It's nothing I can help, right? I'm going to do the best I can to manage them. And often there is a lot of relief and understanding.
Yeah. Yeah.
That's on the positive side. Sometimes, unfortunately, there's disbelief. And that is something that the couple has to, really work through. I don't work in that regard. But I have had clients whose partner was like, no, especially around the autism thing or the ADHD thing, is like, you're an adult. How can you have ADHD? Or, you got through medical school. How can you have ADHD? Right? Like it's been fine. There's often a trigger where all of the coping strategies that have worked up until that point no longer work. Sometimes it's like medical school or, residency, but sometimes it's like having a child where I was able to keep all of these balls in the air, but now you bring in that child or you bring in an aging parent and suddenly I just can't do it anymore. I had one client who was just moving. She moved homes and that was it. The organization that it required to sell and pack and buy and all that, it's like all, her whole little house of cards completely fell apart.
Yeah. I mean, as I listen to you, I'm like, oh my God, there's such an education that is required, and not just for the individuals who are experiencing these, but for the culture as a whole.
Yeah.
Because I mean, and anyway, I come from a pretty conservative culture overall. I grew up in Nigeria, and then also previously in a conservative culture where there is a lot of disbelief around, a person's diagnosis. People will throw words around like, oh, that's not real. ADHD is not real. It's an excuse.
Yeah. Parenting.
Yeah.
It's because the parents weren't in a certain way.
Yeah. Or even it's a sin.
Yeah.
Like, the sin of laziness.
Yeah.
Almost like, oh my gosh, like we are in this culture where in some ways the culture has been set up to not accommodate all the brains that we have. And then there's also in many places this cultural narrative that the way neurodiverse brain shows up is bad.
Very much.
Yeah, I homeschooled my kids early grades, and one of my reasons was because I was like, I looked at my son and I was like, I don't know that I want him sitting in a chair.
Yeah.
For 8 hours a day. I'm like, that doesn't make sense. He's bouncing around. He's like, so kinesthetic, and I just don't know that I want to do that. And so when I think about just so many brains put together, you have 30 kids in a class, and the idea is to provide education. But when you have a culture that also doesn't take into consideration that, and then it also has a narrative that can be harmful, how can we, I don't know, I think all of us have a role to play in creating that change. What are some ways that we can create change? Wherever we are, whoever we are, and saying, hey, there's a thing that we haven't been looking at for a really long time.
Yeah. And I'm just starting to sort of like creak open the door of the, social justice aspect of neurodiversity, right? And I think from us, the first is educating ourselves. The second is belief. If somebody comes to you and says like, I have dyspraxia, which is a neurodiversity that involves like motor movement, believe them. Like no one is people don't generally make these things up, and ask them like, okay, what do I need to know? Right? How does that impact my relationship with you?
Yeah.
And then decide if that's something, and I say to people, I said, that smart, but maybe a little bit quirky person is doing the best they can to appear like everybody else. So even there's this whole discussion about masking and the effects of masking. And masking is the idea that like you're trying to look like everyone else, right?
Yeah.
And so maybe give them a little bit of, latitude. Let them know that it's okay to bring their true self to whatever whether it's to work or whether it's to a social, gathering. And if they say or do something that's, maybe seems odd to you, don't call them out. Just say, you know what, that's part of our differences.
Yeah. Oh my God, that sounds amazing. What I heard you say was, hey, have curiosity. Again, maybe this should have been a class in in high school. Like, hey, well, we didn't get that class. I didn't get that class. So we educating ourselves, just being like, hey, if this person says, hey, I have, this diagnosis, just being curious. What does that mean?
Right.
How does that show up for you? What is your experience with that?
Yeah. Right.
I think that's the first really compassionate thing that we can all do, is to just be willing to learn and know and see the other people around us.
Exactly.
Yeah.
Right.
For some of my clients, and this is where I think really defining what we mean by that can be helpful. My ladies are always, they're the most wonderful, women in the world. And they're always like, I don't want to be judgmental. I don't want to be mean. And because women are socialized to be accommodating and nurturing, in the dating field, they will then feel obligated or have thoughts that make them feel obligated to accommodate a person who has a diagnosis in a romantic sense.
Yes.
Where there is a difference between being curious and compassionate and then deciding this is your one person. Absolutely.
Absolutely. And there is no one diagnosis that is not dateable, right? The view that, people with autism, don't have feelings and can't connect, and that's false, right? And there are many, many people with autism who are happily married.
Yeah.
But the individual, that it's not something, these neurodiversities are not something that anyone, because I'm a woman too, we're not fixing.
Yes.
You have to be willing to say, can I live with this? Can I accept this? Whatever it is, right? You love cheese, and that person, the sight of cheese or anything dairy makes them gag. Can you live with that?
Yeah.
That's up to you. But it's not, it's not our role to try and fix whatever neurodiversity it is. And we don't have to, there's no judgment if it's something that you just can't, like, I just can't do it, right? This person with ADHD that, it's not intended in a bad way, but like they talk a lot. Many people with ADHD, they have many thoughts going through their head, and it comes out their mouth, and they talk and talk and talk and talk. Some people might love that. They might love the interesting things that come through their brain because they're so smart and they're so creative. And for other women, it's like, I can't handle it. That there's no judgment on that. That's a personal preference. It's as if we were to say, like, well, there's a problem with you because you don't want to, you don't want to date somebody that has, I don't know, hair on their chest or blonde hair.
Yeah.
There's no judgment. Personal preference.
100%. Yeah. A lot of times I think our dating, the dating world is, the narrative in the dating world is, I could just keep going on and on about how just we've gotten our education from the movies, and it's awful. I often have to tell women that, listen, because often we have this, like, we make meaning out of external attributes. So there's this language around, well, men who are in their 50s and have never been married are this way. Men who are in, this person is that way. Same thing in this area. People who have OCD are this way. And I think the sentence that I have just said over and over and over again in my coaching practice is, it's not about the external attribute, because it doesn't always mean what you think it means.
Yeah.
It's always about the human in front of you.
Exactly. Right. That's amazing.
So when you're texting, it's not about what you think, it's about who is this person, and then asking them questions that let you know who they really are.
Right.
When you're sitting across from them, looking at this person, getting out of your head, experiencing what's happening in the present, so that you can decide if this person is for you or not for you.
Right.
Yeah.
And it's a personal preference.
100%.
And there's no one should judge you because you can't, it's what you decided.
Yeah. And I think we might be surprised at, because I also think here's also another one of the principles that I've brought into dating is I'm like, most of us don't know that many people. Most of us don't experience as many people as we think we experience.
Right.
We're experiencing people on social media, quote unquote, experiencing people through the movies. But sometimes I will ask my clients, I'm like, okay, well, so how many, we're looking at the profile and maybe there's a diagnosis on there or there's something in there. They're like, oh, this person said this.
Yeah.
And this is what it means. And I'm like, so how many people who have this or who say this have you actually experienced in person?
Right.
Have you ever met someone who is autistic? Have you ever had a conversation with them?
Yeah. Knowing that they were autistic, because you probably have and just didn't know.
You just didn't know. And that's usually a light bulb moment for them in that, oh, my brain thinks it knows and can make a decision or can interpret what I'm seeing, but maybe it can't.
Yeah.
And I'm often calling them to be curious, to, just go on that first date. Just go and see. They hate that. It's like, I don't want to handle having to say no. I don't want to handle that feeling of, well, I did go on that first date, and now I really don't want to date someone who is this way or has this, and they don't want to have to say no. If someone does meet someone who is neurodiverse or who reveals that they're neurodiverse and they do give them a chance, so listeners, within reason, because like Krystal said, this is not an obligation to say yes to someone. What is language for navigating? Hey, we've gone on 3 dates. You're amazing.
Yeah.
But we're not a match. Do you have language around that, or how can women have that conversation in a way that is kind and yet clear?
I think that it's the same conversation they would have with anyone else, right? Because they're not deciding they're not a match because they have, OCD. Maybe they're deciding they're not a match because it makes them uncomfortable, whatever their, repetitive behavior is, right? Whether it's, and OCD doesn't always manifest as like hand washing and, counting bricks and
like the movies tell us.
Right, exactly. But whatever, there is just something about that individual that just doesn't sit right with them. And whatever they would say, we would never say, you're not for me because I don't date men with 4 kids. It's like, no, it's probably, somebody might, but it's probably like, you have your 4 kids. It's really busy on the weekends. I don't want to spend all my weekends driving from one kid's activity to the other. So you're a great person, but I'm going to pass.
Not for me. Yeah, 100%. And for every person who says, hey, someone with 4 kids or someone with young kids or someone with kids who live at home is not for me, then there are the people who are like, yeah, let me meet your kids.
Yeah.
I have 4 kids of my own. How do you feel about a household of 8?
Exactly. Exactly. When I was dating before I got married, if someone was like, I have 4 kids, I'd be like, bring it. I have tons of them.
Yeah. My husband, his son was getting ready to graduate college, and I have, 5 children, of course, living with me and my ex in varying numbers, but he knew that at some point in this relationship, he might have 5 children, 5 of my children in his old age. There are men who have, newborns. Like, it's just the combinations. And I think so for someone who's neurodiverse, here's what's amazing. Just like, you mentioned earlier, people are getting diagnosed. These humans have always been here.
Right.
For someone who has a diagnosis, there is the huge possibility that the next person you're going on a date on is someone who has the same diagnosis, who is handling something similar, and you
Right.
could be the best team.
Right. Exactly.
Yeah.
Exactly.
Or someone for whom you're the perfect complement.
Yeah, you balance each other out, right?
Mm-hmm.
Sort
Yeah.
of the person who has, difficulty with the person with autism that has difficulty in like large settings, like large social settings, does great one-on-one. And you know what? You don't like large social settings either. You hate small talk. You're perfect,
Yes.
right?
Yeah. One of my clients went on a date, a really good date recently. It wasn't a romantic match. And she has really severe social anxiety. And so she really doesn't like leaving her house. It's a lot of work. It's like 3 days of mental prep for her to leave her home to go do something. And so, she uses the apps to date. And what was amazing was she swiped on this person on Bumble who said, "Hey, I'm really shy. But once I get to know you, I'm a really great person to have conversation with." And she went on the first date with him and they had a really, really good time, and I was like, oh my gosh, I was really rooting. I was like, I wish this would work. But there were other factors that made it not a romantic match. But there was that person out there who could have been a match for her. And there are more people like that.
Yes.
Out there as well.
Yes.
Yeah. Dr. Krystal, this has been such an enlightening conversation. I really, really appreciate you coming on. Do you have any advice, anything we didn't cover, anything you just want to say to the ladies who will be listening, or others who I've had men write to me too, or non-binary persons who have listened to so whoever is listening, do you have anything you'd like to say to them?
Yeah, I would say what we started out with: if you or someone you love has a neurodiverse diagnosis, don't make them wrong for that. Love and embrace all of the traits, the gifts, the struggles. We all have them. Some of them just tend to be grouped into what we call a diagnosis, but embrace who they are and love them for who they are, even if it's not a romantic match.
Be willing to see that. Be willing to see the human. Thank you so, so much. Can you please, just for those who are interested in connecting with you, just kind of give us a recap of who you work with, how you work with them, and also where they can find you if they want to connect?
Yeah, awesome. Thanks. So my website is neurodiversedocs.com. It's all one word. And primarily I work with physicians, mostly because I work mostly with highly intelligent people who also are who also have a diagnosis. And that's just sort of easy for me to, say, oh, most physicians are going to be cognitively gifted. There's no IQ check at the door. And so that's why I mostly work with physicians. But if you find that you also, are gifted and you have a neurodiversity, then we just schedule a discovery call and make sure it's a good fit for both of us. And then I call it a what now call, because most people think like, oh, I have this diagnosis, now what? And so you can reach out to me, either through my website at neurodiversedocs.com. I'm mostly on LinkedIn. That's my favorite place. And that is, I'm at Krystal Sodaitis. I'll leave the link because that's a lot of letters on LinkedIn. And that's where I do most of my posting. Facebook and Instagram, I usually drop a few things there, and it is Life Coaching for Gifted. On Facebook and Instagram. But this was a beautiful conversation. I absolutely loved it. Thank you so much for inviting me. And I wish your listeners like the most fun dating after divorce.
Yeah, thank you. Thank you so much for being here. Listeners, we really, really appreciate your time and attention on this episode. I will have all of Dr. Krystal's links in the show notes. So if you are interested in connecting with her or just reading more about this topic, I think we really all have a responsibility to be educated, to move through our connections with other humans in a way that is curious and compassionate and open-minded. So please follow her on LinkedIn and other places on the internet. We thank you for your time and attention, and we will see you next time.